In an ageing population, we are living much longer lives. However, the problem with longevity is that there is an increase in the likelihood of bone diseases, and we need to be able to repair this. However, with more and more surgery, although being very successful, there is a 1 in 100 chance of infection.
The discovery of antibiotics was a huge turning point in medicine and are vital for survival. They are especially important in the surgical environment. But why is this?
Most of the time, our skin is good at keeping bacteria out. However, when we have surgery and our skin is cut open, this creates a direct entry pathway for bacteria. These bacteria can multiply within the body, preventing wounds from healing, damaging surrounding tissue, and threatening the life of the patient. When we get infected with bacteria, the bacteria need to be killed before it can begin to cause damage. The bacteria will compete with our own cells for resources such as food and water, and sometimes becomes too much for the immune system to control. In this case, we need antibiotics.
Therefore, after surgery, patients are given antibiotics which kill the bacteria and allow the body to heal. However, these antibiotics are currently injected into the patient's blood and have to pass through the body to reach the site of action, exposing the gut bacteria to the antibiotics unnecessarily, and this increases their risk of antibiotic resistance. But why is this such an issue?
In a population of bacteria, some will have advantageous traits that allow them to be resistant to antibiotics. When this population is treated with the antibiotics, those resistant bacteria will survive and reproduce, forming a whole new population with this resistance. This will form a resistant strain, and before we know it, these superbugs could be fatal. Scientists at the University of Southampton are developing new materials that can be used during bone replacement surgery to reduce the need for IV antibiotics and therefore reduce the risk of antibiotic resistance.
One of the key strategies we're developing in our group is using novel materials to deliver antibiotics and sustain their presence at the implant site to continue to fight infection. We're using clay gels, which you can inject or coat an implant with. But what makes them really exciting is they bind drugs and growth factors and also antibiotics. And so we're exploring the use of these clay gels as a way of holding antibiotics at the site where you need them at high enough concentrations to continue fighting infection over the life course of the implant.
In previous techniques used, antibiotics came into contact with bacteria from a wide area around the site, and therefore were less efficient at killing bacteria directly at the site of the new bone. This new method allows a higher concentration of antibiotic to reach the desired site of action, with less of the body being exposed to the antibiotic. The clay gel allows targeted delivery of the antibiotic, a key strategy in overcoming antibiotic resistance.
So as you can see, using these methods with the new clay gels, the antibiotics can be targeted directly to the surgical site, so less of the body comes into contact with the antibiotic. With this new method, the risk of antibiotic resistance will hopefully be lessened, and this resistance will become less of a threat.